And we are recording. It's happening. Dr. Bill Selig, I could not be happier to be talking to you right now. I wanted to just keep talking to you off mic for another hour, but I have to hit record. We have to get into it. So welcome to the Beautiful Voyager podcast.
Thank you. Yeah, thank you.
We have known each other for years. We've known each other for many years. We were just talking about how you were one of my early calls, maybe when I was starting Beautiful Voyager, because you are a psychotherapist. And do you remember how I got in touch? I don't even remember like what led to me to get in touch with you about that.
Well, I don't know. I mean, we knew each other personally through my wife, right? And so I guess we, talked a little bit about, I remember you telling me about this interest and project that you were working on. And I don't know, at a certain point, you were like, he's a psychotherapist.
I was like, you know what? That kind of psycho is the one for me, therapist. I feel like I've learned so much more about your work though, now that I have read your new book, When Your Partner Has Bipolar Disorder. That is a good, strong topic. Helping you and your partner build a balanced and healthy relationship. Can you tell me how this book came to be, Bill?
Sure. Yeah. Actually, the publisher, the Rockridge Press and Callisto Media is the company. They approached me actually. They're doing, I guess, I don't know what you would call it, maybe data-driven publishing. Like they did kind of market research first and identified an unaddressed niche, basically. And they said, this is the market or the world wants a book like this. Let's go find someone to write it. And that's how it came to be. They approached me and I was like, definitely, because I don't know. It wasn't hard to write the book because I'm basically writing down stuff that I've been saying to people that I work with for years. So it's all like I could, it's
the knowledge was all right there. The knowledge was all right there, like a sea full of fish, and you just had to like reel them in one after the next.
Yeah, or like dump them all out on the pages. Yeah, and it was I was very excited because it's it's like, well, this is something I feel competent to talk about and help people with, and I've learned how to talk about it in a way that I think helps people. And now someone wants me to like put it all out there so a bunch of people can benefit, not just the people that I'm meeting with in my office. It's awesome. I was really excited about it.
And you had worked before on a revision. This is interesting to me. I want to know more about this. A revision of the psychotherapy for bipolar disorder treatment track at Kaiser Permanente. So that was in 2014. So what was that? Like, what was it before? And then what was it after?
Oh yeah, that's a good question. Was it before or was it after?
Like, why did it need a revision? Why did it need a revision?
Right. Well, there were certain, everything that Kaiser does is very research based. They want to make sure that what they're doing is cost effective. That's, they're all about that. So there are elements of the program. The way that program works is there was a class called Bipolar 101. So let's say you get diagnosed with bipolar disorder at Kaiser. The first thing is go to Bipolar 101. It's a one-time class. It was one of the things that I taught while I was there. I did that one. And then from there was a group that was like a bipolar education and support group. That's what it was called. And you would enter that group. And it went on, and then there was also a support group component. It was sort of like people wanted to have an ongoing, people didn't want to leave. And Kaiser's always trying to figure out, like, how can we give people what they need and not more or less, but
Yeah, yeah.
give them what they need. And then, I mean, their model is a model of empowerment, self-empowerment. Like, they don't want people to be dependent on care, is how they would say. And so we were kind of looking at that, I think, was the impetus of the revision, was to look at that, because a lot of people with bipolar disorder want ongoing support. And
Mm.
one of the things I write about in the book is it's a very helpful thing to be going to a peer support group or to an ongoing psychotherapy is also even ongoing supportive psychotherapy that isn't necessarily focused on like change or teaching people to do things differently. It's just supportive, um, is very well. I mean, it's important, and it is research supported, in fact, for bipolar disorder. But that has to kind of be established, because that's not the case for all psychiatric illnesses. It's not. It is, yes, for sure. Ongoing support is helpful for anybody with anything.
But how needed is it? Like, how much is it worth that money that it would cost to do that?
Right. I mean, some things are more resolvable, right?
Yeah.
Like a phobia, for instance. Like, if you have a specific phobia, you're wanting to be able to air travel, and you can't air travel right now. Let's work on that until you can get on an airplane, and then you don't need ongoing support. But this is different. This is a chronic condition. And so that's why, yeah, that project for me was about really doing a full survey of the literature and understanding what's there and also what's not there. I mean, that's always the question with the literature also. Like, you want to say, well, we provide evidence-based treatment, there's no evidence for this. But if there's no evidence, that doesn't necessarily mean that it's not helpful. It just means there's no evidence yet, or
It
something
hasn't been studied in that way. It
hasn't
hasn't
been
been studied.
studied. Yeah,
Yeah.
exactly.
How has the entire topic of bipolar disorder changed in your career time? Like, when you started, when you wrote your dissertation, like, where were we and where are we now?
Mm, mm. That's a good question. Um,
Just
hmm,
because when I was little, manic depression, right? Isn't that what it used to be called when I was little?
yeah, I
A long
guess.
time ago, 70s, 70s, 80s, early 80s, maybe. I
Yeah.
don't know.
Yes. Yeah, that's true. I mean, because it's a second career for me, it hasn't actually been that long. Like, for me, when I did all that research, it was 2014 or
Oh,
something
I
like.
didn't realize it was that recent. Oh,
Yeah,
okay.
13, 14. I was a postdoc at Kaiser. Um, so yeah, I don't know. I mean, the medicines keep developing, and the knowledge about the medicines keep developing. And ketamine is a newer thing that some people are using for bipolar disorder, and TMS. That's a new thing that's on the scene. Um,
Is it
mm,
hard for you to stay up on these? Like, how do you stay up on what's happening if it's so evolving?
yeah. Um, I mean, I read about it. I keep up on it. Um, uh, I think I keep my eyes open, and there's some journals that I read and stuff like that.
But there has not been a sort of distinct, like, this is the thing to do. There's no obvious answers when it comes to medication or treatments, right? Or
Right.
what? It's
Yeah.
different.
It's. I mean, there's a lot of different medications that you can try, and none of them work the same for every person. So it's just impossible to predict. It's like, okay, well, there's 10 different things that we could use as mood stabilizers, some of which are also what's called an antipsychotic, and these are also can be used for mood stabilizers. But for some people, this medicine, helps bring you down, uh, but can knock you way down. But for some people, when you give them this medicine, it actually brings them up and stabilizes them. And I don't know which of those
That
people.
has always bugged me so much, Bill. I can't stand it. I hate the idea of, like, even for myself with my SSRI, having to take it and be like, well, we'll see. We'll see what happens.
Happens. I know.
But I guess it's because we're human beings and there is no perfect science for our incredibly varied brains and body
Right.
chemistries.
I don't know. I mean, I don't know what you think. What do you think? I mean, to me, it seems like brain brain science is still quite young and primitive.
It's a little infant. The tiniest little infant. There's
Right.
so much that we're just starting to understand, and
Right.
definitely the resources have not been given to it.
Yeah.
I
So
agree with you.
I'm hopeful that there will be uh, that it won't, maybe not that far in the future, relatively speaking, that people always say like, well, I wish I could have a brain scan or a blood test that will diagnose this and
I
then
know. Oh my
instruct what
goodness.
medication to take. And it's starting to come with the SSRIs, right? The blood test, there's this blood test now. It's
Yeah, I
starting
heard
to
about that.
come. Yeah.
Yeah, that is really cool. I here are some things I love about your book. It's very easy to read. It makes a lot of sense in terms of how it's organized, and you use case studies or just stories of people in such helpful ways. Um, was it hard for you to come up with the right stories at the right time? Did you just have like enough stories in your world to be able to like gather them together? How did that go?
Hmm. Yeah, it's funny because actually the stories was the hardest part of the writing for sure. Not because I haven't encountered all of those things that I wrote about, um, but because I'm not a natural storyteller. It's like not my, like making up a story is not my forte. And all of the stories in there are, they're all amalgamations. They're not, they're not like this person that I, worked with. I mean, some of them are like that. But yeah, finding the right story or making the right story to match the content of the chapters, that was the hardest of all of the pieces.
And I actually think that's why it's so good. I mean, it it there's a lot of factual information, and that factual information is well described and it's approachable, but it's the stories that really help pop it to life.
Hmm. Well, that
What
feels good. I'm
Yeah,
glad that I did okay on that.
you did okay on that. What is your dream for what happens with the book? Like, how are you hoping people will come to it, or when will they use it?
Oh yeah. Um, maybe I have maybe I have um, mm, uh, inflated idea of how many people would benefit from it. But I just feel like when I talk to people about my work in general, if I tell them that I work with bipolar disorder, like so many people kind of perk up and are like,
Mm,
oh, I know somebody who, like so many people have somebody that they either that a friend that they love who is in a relationship or someone in their family or whatever. And I think because it is a very it can be a very difficult, you know, impactful condition. When somebody has it, it can impact the system around them, their family, the support system so much. Maybe that's why so many people respond, but people do respond. So I have it in my head, anyways, that it's that a lot of people are going to, when they find out about it, uh, want it. I mean, mostly I would think that it's a newer diagnosis. Like, most of what's in the book, if you've been living with this, for 20 years with a partner, I don't know how much you need this book. You might be interested, but probably you could write it yourself or a lot of it. You know what I mean? So I hope for it. I think of the audience as mostly or more so anyways, people who really don't know anything about it.
or just wondering, like, is that what's going on? I had like a depressive episode. I had this like with my partner, and
Right.
that seems like it's a great fit.
Yeah.
I don't know if this is just my perspective working in sort of mental health writing, but I feel like the stigma around bipolar has radically changed in the past 5 years or so. It
Yeah.
could just be my knowledge, though. It could be my knowledge. Do you think that's true? Like,
No,
what
I
have you
do.
seen?
Yes, no, for sure. Yeah, because of the amount of celebrities, I think, who've come out and talked about it uh, openly. Um, it's been, I mean, really, really positive development, I think, in terms of stigma. There's still, you see the depictions in the media, movies and TV and stuff, and some of them, you know, feel unhelpful to me, but more and more and more, they seem like, mm, well done, and like that this is going to.
It's getting better. They're getting more sophisticated in their knowledge. They're like starting to get it.
Yes, I think you're right about that for sure.
And so you had this, your dissertation specifically was creativity and bipolar disorder. And what drew you to that? And like, what are some of the things that you've learned in your practice around creativity and bipolar?
Yeah, I mean, they are definitely linked. What I was exploring in my dissertation was there's a difference there's a very clear, well documented connection between bipolar disorder and what they call eminent creativity. So if you look at the population of people who have been recognized as geniuses, or having achieved a lot, there's a higher proportion of that population has bipolar disorder than the general population. What I was looking at was whether there was a connection with everyday creativity, and that has not been. So in other words, like, yeah, can you see that people who have bipolar disorder tend to be somewhat more creative than people who are
So
not.
you're saying, like, at the extreme level of creativity that we know, a high portion of those, or higher than average,
Yes.
is bipolar. But then you're wondering, with like the rest of the bipolar world, are we also seeing elevated creativity?
Right. Yes, that's exactly right. That's
and what have you found so far?
So it's not. There's no conclusive evidence about it. Yeah, the data set that I was looking at didn't show a significant linkage. And yeah, that's not. So it's a really interesting question, though. I mean, if you think about, like, Vincent van Gogh is like the classic example.
I was like, obviously it's Van Gogh, right? Obviously.
Right. Classic example, right? And then you can wonder, like, if he had medicine, or if he had a less severe case, would he have, had such a output? And it's hard to know. It's hard to know. But the other thing, if I could say one more thing about it, is interesting to me, anyways. There's the evolutionary biology perspective would say, like, well, why is this thing still around? It's not a virus, it's not contagious. Like, wouldn't this get selected out of the population if it was such a deficit? So there's that.
It's a great question.
Yeah.
It's a great question. Something interesting that we talk about a lot in my work at Pinterest, my job, is around creativity and emotional well-being. And we're often saying, like, does helping someone's emotional well-being help them with creativity, considering what we've seen with creativity of these cases, like we're describing, these sort of like extreme creative cases. And I have a feeling that the answer is something like, in extreme cases, there's one set of information, but bringing sort of the rest of the world to a level of emotional well-being may help with creativity. I'm just very curious about that topic, because I want to make the argument that creativity is a path towards emotional well-being, that helping yourself understand how to be creative and have creative outlets can help your overall well-being and your emotional well-being.
Right.
Just always thinking about that correlation.
Yeah, that's super interesting. I'm sort of taking in what you said. Yeah. I mean, that's two different ways of, like, creative activities are stress relieving usually, right?
Yes.
So it's like saying, like, if you're super stressed out, well, are you exercising? Is one thing. Yeah. So it's good for your well-being to do creative stuff. That's one. But then another side is like output, outcome.
if you are the same person, and in one state you are sort of feeling better, or you're in a better emotional state, like, does that help you become more creative? Both of those are like the two areas that I'm curious about.
Right. Yeah, and it gets really complicated in bipolar disorder, because the answer is, for many people, yes. When I have having an actual clinical mood episode of hypomania or mood elevation, I am actually more creative.
Yes, exactly. I know. God, it's always so messy.
It's a
If
rough
there
one.
was, it's such a rough one. If there were something that you could learn that you don't already know about bipolar, like, let's just say the science were there, or a study were able to be done, what would it be? What are you very curious about that you haven't been able to figure out?
Mm. I mean, we were just talking about one of the main curiosities that I have
Is the
uh,
creativity. Yeah.
is the
Yeah.
creativity piece. Um, but there's other ones too. Um, I don't know. I mean, something about this, like, question that people are left uh, with this condition of, like, which me is the real me, or how can
Mm.
I be, people want to be able to be in that hypomanic range, right? And I guess I sort of wonder how good we can get um, at fiddling with our moods, because there's a lot of fiddling more and more these days with the microdosing and all sorts of, um, all sorts of ways.
Optimizations, mood optimizations.
Yeah, yeah. And that stuff comes into play. People are with bipolar disorder are often doing stuff to try to control their mood. Some of the things people do are very unhelpful, or the things that destabilize the condition generally are things that people are doing to try to control their mood, and they're ineffective. But there are things that are effective, like yoga is effective for helping bipolar disorder and helping everybody control their mood. So, wouldn't it be nice if you had bipolar disorder and you knew what it was like to be in that hypomanic state? Could you somehow, keep yourself a little bit higher than your, yeah, how good can we get at modulating?
Super interesting. What is bipolar often comorbid with? Like, what are the other things that tend to come with it?
Yeah, I mean, the biggest one is substance
Yeah,
abuse
yeah, yeah.
disorder, for sure. For this exact reason. I mean, there's just no better way to manipulate your mood than a substance. Um, so that's the
And
big,
so then you're dealing often with a partner, you probably are like trying to pull out these different threads, right?
right. What do you mean when you say pull out the
Like
thread?
that if your partner has bipolar, maybe there is a chance, elevated chance, they also have substance abuse issues.
Yeah, quite
And you're like trying to figure out what's what, and
right. Yeah. And it is important to see it holistically, and to see, like, I responded to your use of the word thread, because I think it's a really good word, because it's like, and if you use that image, people are tapestries with
yeah.
lots of different threads, right? So if you pull, I mean, yeah, I need to not feel depressed, and so if I use this substance, then I don't feel depressed. Okay, okay, like, and that works in that way, but then it also has these other effects. So what if you don't pull on that one? Is there some other kind of thread or some other way that you can pull so that you don't feel as depressed?
Beautiful Voyager is for people pleasers, perfectionists, and overthinkers. How does that group, which I think of as like generalized anxiety disorder world,
Mm,
overlap or not with bipolar world?
mm, mm. That's interesting. I'm curious to hear your reflection on this, what I'm about to say, and then I'll ask you a question. When you say people pleaser, to me, in the context of bipolar disorder, I think caregiver, And I think,
Mm.
you know, codependency, or like, you know, yeah, like I'm taking care of, it wouldn't have to be bipolar disorder. It could be any,
Mm-hmm.
right? Anybody with, who's in a caregiver position.
Mm-hmm.
Now I'm
Mm-hmm.
set up to sacrifice my own needs to take care of this other person's needs, which is exactly what a people pleaser does, right? So
Yes.
I don't think of that as, although, but I can see it. General anxiety disorder, it's just anxiety, absolutely. Um, but it sets you up, I guess. It wouldn't have to be general anxiety disorder to be set up in that way.
Yeah, absolutely. Um,
Which,
do
by the
is
way, I definitely have my own. I think everybody is really everybody. I don't want to say everybody. Many people are unbalanced one way or the other. You know, I'm more of a taker. I'm more of a giver, and so I think it's really cool that you're attending to that.
it's
It's
nice when there can be, if you're in a relationship, there you can find some matching there on some of
right,
those traits
yeah, but and not be too out of whack.
and not be too out of whack
Right,
and like learn to push to like help balance yourself too. Yeah, for sure.
right. So this awareness building that you're doing is so. I just really like that. I like that you're doing it. It feels important, you know.
It's helpful for me. It helps me. It helps me feel like uh I'm seeing the conversations I want to see in the world with people like you.
Mhm.
Like, you get to talk to your patients and you get to write a book, but let's keep pulling it out and getting it out into the world more.
Yeah,
It's helpful.
yeah. Yeah, it's helpful for me. It was helpful for me to write that chapter too, because I do. Yeah, if anything, I'm on that unbalanced side of the people pleaser side, right? So writing that chapter about the boundaries and stuff, you know, I mean, that's all stuff that I know and that I work with people around, all that stuff. But every time I go over it and see it in different people's relationships, because it looks a little bit different each time. Um, you know, it's a heightening awareness, right? As we all heighten,
Yes.
it's okay to be. So my personality was kind of molded to be more of a giver than a taker. That's okay. Like the main thing is that we are developing insight into it as adults, and then we can make choices and, you know, learn to do things differently and stuff like that.
How early in life does bipolar start exhibiting itself?
I mean, it can be really early. They're diagnosing kids down to like 4 or 5 years old.
Oh, wow.
Yeah,
I had no idea.
sometimes. Yeah. I mean, I don't. mm, I'm not informed enough about the research to say what I'm about to say, but I'm going to say it anyways, which is like I feel a little bit dubious about a diagnosis that early in a kid's life, because it's like the kid is still growing,
Understandably. Yeah, understandably.
so many environmental factors and stuff. But there does seem to be like, yeah, you could see certainly, you know, an 11-year-old, um, you can start to see these patterns if they're episodic. You know, there's a long period of time when they're depressed and you're hearing maybe some really dark stuff out of them, and then there's periods of time when they're having this burst of, you know, happiness, and it's periodic. That's the main thing. And it's
Yeah,
like, oh,
yeah,
this looks different than, you know, mood regulation, which is what, then that looks different. uh,
yeah,
like reactivity, mood reactivity, and emotional regulation. That stuff looks like reactive. Like, oh, when something bad happens, then this person gets really depressed. When something good happens, they get really excited. That's different. That's not bipolar disorder. Right? Bipolar disorder is when we see it in a long period of time of depression.
without these kickoff, without sort of more traceable events.
Exactly, exactly. And it's a real tell when you see the opposite, when you see like, wow, this person, you know, got a raise at work,
Right.
and they're just coming home, flopping on the couch and being like, yeah, I don't deserve this. You know, I feel
Yeah.
terrible about myself that I got this raise. And it's like, oh, maybe you're depressed.
Mm-hmm. Mm-hmm. Yeah, absolutely. There is a leader at my company who has spoken openly about her own bipolar journey, and I find it incredible. I mean, I am so in awe of leaders in very visible positions who share these stories. And I just always want to encourage people to do that, because I think it just makes a huge difference.
So brave.
I know. I know. But hopefully it'll be less and less brave, because it'll be more and more
Right.
unstigmatized.
Yeah. That's awesome. That's using their place of power um,
Yes.
to change the world in a
Yes,
positive
I
way.
agree. Yeah, I totally agree. Um, do you have anything that you would like to share? Anything that you've just been like chewing on and haven't gotten to talk about in another environment that you would like to share with the Beautiful Voyager audience?
Hmm. Um, well, hmm. I mean, I was talking a little bit about it just a second ago. I'm very interested in the overlap of these diagnoses of bipolar disorder and borderline personality disorder,
Mm,
um, which are totally different um, situations, but they get confused a lot. And the borderline personality disorder, and some other things also, which get called personality disorders, which in and of itself, I have a big problem with that language. Um, uh, they they look like the reactivity. That's what they look like, and they're learned behaviors that can be unlearned. You can learn how to modulate your reaction when something good happens or something bad happens. You can learn how to do that differently. And if somebody is reacting in a way that society wants to call disordered, you have to really look at society, and you have to look at context, and you have to, why is the person doing that, and maybe they're not, maybe the pathology doesn't lie in the individual, right? And then there's I'm very interested and involved in treatment that helps people unlearn habits that maybe they learned because they were raised in invalidating environments or went through a lot of trauma, or so I'm really interested in how trauma impacts personality.
that's
That's really
fascinating.
one of my main interests, and this is so totally different. This is an organic brain chemistry situation where you can't unlearn, you can't like learn how to not have bipolar disorder. You
Right,
can learn
right.
you can learn how to make your life more stable and therefore cope better with the condition and have the condition be less disruptive to your life, which is awesome that you can do that. And these things then interact with each other also, because there is comorbidity there too. And it's rough if you have both borderline personality disorder or emotion regulation stuff, and you also have bipolar disorder. They feed off each other,
Oh
and
my
then
God, it sounds like hell to me when I hear that. That just sounds like hell.
it's really hard, but it's
I
not.
mean, each of those is so difficult. The thought of both is just really, yeah.
But then, it's the treatment miracle that I've seen is with the borderline personality disorder stuff, which again, I kind of I use it label because people recognize it, and
Right,
some people know what it is,
right.
uh, uh, yeah, but the thing that's the treatment miracle is that it can go into remission if you want to talk about it as a
And that's through DBT, right?
through DBT, yeah,
Yeah.
yeah, and other
But
kinds.
DBT can help other people too. That's the interesting thing, right? It's like this way of thinking and this way of, yeah.
Yeah, can help everybody. It's helped me a lot. It's just about living skillfully, and that's
Yeah.
what works for bipolar disorder for that exact reason. Like, you need the psychiatrist to help you with the chemistry, uh, but it also matters if you're living a stable lifestyle. It also matters if your relationships are stressful. It also matters if you can address what's making it so that you're not staying on your medication, or if you can get the substance use off board, or all these lifestyle issues. The DBT can help with that, because it is hard to make those kinds of changes, and there's reasons why, and then there's skills that you can learn, and a framework in which you can learn them to make new habits. And that can make you, so you have bipolar disorder, but guess what? You're functioning a heck of a lot better than someone who doesn't have any psychiatric illnesses, and yet, you know, behaves unskillfully.
Yeah, it doesn't have the skills.
Yeah, it's cool.
Bill, I'm so glad that you're out there helping people. I mean, I feel like we're lucky to have you.
Oh, thank you. Feeling is mutual.
Oh, thank you so much for joining me here. I feel like I'm learning so much from you, from your book, but also just getting to talk to you. I look forward to getting to talk to you again for your next book.
We'll see about that. We'll see about that one. This one is a lot out of me, but thank you. And I want to say, like, that piece, like you said, somebody at your company, um, uh, you know, just coming out and, like, what you're doing of creating dialogue and making it, like, taking the shame away from, yeah, everybody struggles with anxiety. Guess what? Everybody does struggle with anxiety, right? And just creating space for conversation and insight into, like, how does this work, and oh, how does it work for you? Oh yeah, that's how it works for me too. And how do you deal with it? Oh, and that's like, and let's not be ashamed about it. What you're doing is really sort of right there, and I think it's so important. I mean, I just think shame messes us up in so
Thank
many.
you. I feel that way. I feel so curious about these topics. Like, just I'm filled with curiosity and interest. And it's hard for me to relate to people that are so stigmatized and shamed, feel so much shame around it. Though I certainly know that's what society does, but I'm just filled with curiosity. So to me, it's just a
Hmm,
really interesting topic
hmm, hmm,
that is sort of like someone's life story. Like, where were you born? Where do you live? Like,
hmm,
how did you get there? What did you do? These are just all
hmm.
they're almost like factual experiences or something.
Yeah. Yeah, and that, I mean, that's what you're talking about. I hear it as you're just coming from a really non-judgmental place, really just curious, like, how does all
Curious.
this stuff work? And that's how shame goes away, is for us to
Yeah.
be curious and not hide from things that are important to talk about. So I really
Yeah.
appreciate and respect
Thank
your work.
you.
Yeah.
Thank you so much. That's such an honor coming from you. Thank you, Bill. Bye.